am Nadine Carty-Keynes, and thank you for joining us at the Nevis Emergency Operations Center, EOC, today, Monday, 13th July 2020, for an update on the situation regarding the novel coronavirus, COVID-19, on Nevis. I want to thank everyone for viewing. I want to thank the media houses for joining us. All questions will be taken at the end after each speaker would have presented. The Nevis COVID-19 briefing will be aired on Mondays at 8:30 p.m. on Nevis Television, or you can view the briefing on YouTube and Facebook pages of Nevis Television, Nevis HPU, Nevis Disaster Management Department, and you can listen on Von Radio every Tuesday at 1 p.m. With us, we have Mr. Brian Dyer, Director of the Nevis EOC, Dr. Judy Nisbet, Chair of the Nevis COVID-19 Task Force, and Mr. Lyndon David, Superintendent of Police, Nevis Division. I want to say welcome to everyone. I'd now like to welcome Mr. Brian Dyer, who will provide his updates.
Good evening, all. Start with some weather information. Information from the National Hurricane Center. There are currently no new tropical cyclones that are expected during the next 5 days. However, we must be mindful of the Sahara dust approaching the islands and will impact visibility and affect persons with respiratory illnesses for the rest of tomorrow, Tuesday, and we'll see some improvement on Wednesday. I have a notice from the Antigua Met Services. It reads, Air Quality Index based on particulate matter 2.5 and 10 concentration. Synopsis: the air quality has dropped to moderate levels as a result of the increase in particulate matter 2.5 and 10 associated with the surge of Sahara dust streaming across the area. The threat to health problems for many unusual sensitive people, such as asthmatics, is elevated. Air quality index reads 50 to 100. Alert level is 2. Sensitive group: people with respiratory or heart disease, the elderly, and children are the groups most affected. Health implications: the air quality is acceptable. However, for some pollutants, there may be a moderate health concern for a very small number of persons who are unusually sensitive to air pollution. Caution: active children and adults and people with respiratory disease, such as asthma, should limit prolonged outdoor excursions. Stay tuned for more information from the Antigua Met Services and the local Met Service at St. Kitts and Nevis. That report came from Mr. Dale Destin at the Antigua Met Services. I'd now like to turn our attention to some statistics from the COVID-19 Compliance Task Force. They have now conducted a total of 830 visits. This includes bakeries and delis 7, banks and finance institutions 13, ferries, taxis and buses 57, game rooms, gas stations 9, government buildings and departments 104, laundromats 3, market vendors 4, mechanic shops 17, offices 82, pharmacies 2, restaurants 26, salons and barber shops 21, shops 28, snackers and bars 60, stores 60, street vendors 11, supermarkets 7, funeral home 2, gyms 3, wholesale 2, radio station and communications 2, manufacturing 10, hotels 4, and churches visit 102, we visit 85, grand total 830. The quarantine facility at our location in St. James is occupied. I'd just like to appeal to persons who are delivering supplies to that facility that the supplies should be dropped off at the Disaster Management Department on Long Point. The persons at the Disaster Management are responsible for delivering to that facility twice daily, 1 p.m. and 5 p.m. daily. So please adhere to these requests. Again, please to deliver all your supplies to the Disaster Management Facility on Long Point Road. Thank you very much.
Thank you so much, Mr. Dyer, for your update. I'd now like to welcome Mr. Lyndon David, Superintendent of Police, Nevis Division.
Thank you very much, Nadine. Good evening, all. It's a pleasure to be back after that lovely weekend that we had there. At this time, I'll bring some statistics for us as we look and see how the police are ensuring that we deal with the state of emergency and curfew at this time. Thus far, we have conducted 1,108 patrols, 93 vehicle checkpoints, 44 arrests were made, and 10 persons were charged. 16 crimes were committed during the period. 4 arrests were made. We have conducted 3,738 vehicle stops. 11 persons have been informed that there will be summons thus far. Just reminding persons that curfew starts at midnight and our persons must be at home before it starts. Only essential workers are permitted to be out and about an official business. Mr. Dyer mentioned earlier about the quarantine site. On the weekend, we had 2 persons breach the protocol where that is concerned. I will repeat. Let me go to the regulation here that speaks to that. We want persons to understand clearly that when it comes to the COVID site, the site no one should visit. It says here, Regulation 13, restriction on visitation. No person shall visit or be permitted to visit A, any place of quarantine or isolation. B, a patient in a hospital or residential care establishment or facility, including an elderly nursing home. And C, a detainee at Her Majesty's prison. We have had 2 persons, unauthorized persons, visited the site. That matter is currently being investigated, upon the conclusion of which we are looking to take this matter before the court to prosecute these persons. We will be sending a strong message to persons who are intentionally or willfully breaching these regulations, especially where we're dealing with the quarantine or isolation sites. We are still reminding our persons that there shall be no picnics or beach parties or other gathering at the beaches. We want persons to continue to comply. We have seen where we have a reduction in terms of a number of persons attending the beach, because what happened now is much more accessible to everyone. We are saying to persons who are engaged in sporting activities, you're only permitted to practice or exercise. No competitions are permitted. Remember, we are preventing large gatherings. All business operations, we are saying to you, continue to comply with the compliance unit and the task force as they visit you from time to time. Continue to comply and remain open to serve the community. Persons who are planning large gathering activities, we are saying to you that it is not permitted. Once again, persons who are planning large gathering activities, they are not permitted. We do so it's at your own peril, and we will prosecute. All bands and DJs, hi-fis that will play loud music and encourage large gatherings of people to dance they're not permitted to be playing. So we're saying to you, persons, be guided accordingly. Persons who have bars and other places of entertainment, you should not have bands, DJs, and hi-fis to encourage large gatherings. Face masks in public places, we are saying to you, continue to do so. Cover both nose and mouth. And I'm happy to note that, based on my observation, in my opinion, the majority of persons are wearing the face mask. Yes, we are seeing pockets of persons throughout Charlestown and in the villages without face masks. But we are saying to you, the majority is wearing face masks, and we want persons to continue to do so. We thank you for complying with us and ensuring that we reduce or prevent the spread of COVID-19 in our federation. We are seeing where a number of countries have relaxed social distancing and physical distancing protocols. And as they do so, there's a spike. And as a result of spike of infections, there's a spike in death. We're saying St. Kitts and Nevis, we're doing very well. And we have to continue to put our trust in God for his saving grace. So let us continue to protect ourselves, our loved ones, and our country. In closing, I thank God for his continued mercies and blessings on our federation and our persons, both residents and citizens, who continue to put their trust in God so that we will not have any deaths from various infections that we see popping up from time to time. We thank the governments, both federal and local alike, for their support and their contribution in their various many forms, including finance, the medical staff here on island, for your continued diligence and ensuring that we continue to put the necessary things in place. Disaster staff, we have our other essential workers. Thank you for your support. All you citizens who are supporting us in this effort, we are saying to you, continue to do so, as we look forward to ensure that we do not have any new cases. But if we do, that persons will continue to stay away from the quarantine sites and let the officials do what they have to do. To you, the violators, we are saying to you, remember, your life is at stake and that of your loved ones and other members of the wider community. Continue to comply and let us ensure that St. Kitts and Nevis stay safe. Thank you very much.
Thank you, Superintendent David, for your update. Now I'd like to welcome Dr. Judy Nisbet, Chair of the Nevis COVID-19 Task Force, who will provide her update.
Thank you, Chair, and good evening to everyone. As of yesterday, the World Health Organization reported 12,552,765 cases of COVID-19 worldwide, with 230,370 cases in the previous 24 hours, and 561,617 deaths so far, with 5,285 of those deaths occurring in the previous 24-hour period. This indicates that the pandemic is still raging worldwide, and therefore we should not become complacent. Within the Caribbean, as of Friday last, there are 33 affected countries with 67,765 cases. 30,607 of these cases have recovered, and we have had 1,383 deaths within the Caribbean region. Within the Federation, we have had 17 positive cases with 15 recoveries, no deaths, and presently 2 active cases. On Nevis, we have thus far performed 153 tests. 141 of these tests have been negative, 4 positive, and there are 8 results that are pending. Currently, there are 31 persons in quarantine and 256 persons released from quarantine since March. I want to take this opportunity to once again address the use of face coverings in public. I do this because there are some persons who are saying that they didn't realize that we still had to wear masks in public. But what I have observed is that there are a number of persons who are consistently wearing masks in public, and they should be commended. But there are still those who are not, or they are wearing their masks incorrectly, such as covering just their mouth and not the nose. And there are some who simply wear them under the chin, and that's it. As everyone is aware, wearing of masks is one of the public health measures that we have put in place to control the spread of COVID-19 in our population. The disease is spread by droplets. If a person who has COVID-19 coughs, sneezes, talks, or sings, droplets containing the virus can leave that person's mouth or nose and get onto someone who is close by. It can get into their nose, can get into the mouth of the person close by, and cause that person to get COVID-19. But also, someone can be asymptomatic. That is, they can have COVID but not show any symptoms. When that person who is asymptomatic, not showing any symptoms, talks, sings, or simply exhales, because remember, they have no symptoms, so they won't cough or sneeze, but they will talk, they will sing, they will exhale. Droplets can leave their nose and mouth and infect others nearby. So it's for these reasons we ask persons to wear masks, so that you don't spread droplets to other persons, and other persons in turn, if they wear a mask, they would be protecting you in the event that they have the virus. So we have to protect each other by wearing masks. I know culturally we are not accustomed to wearing masks, but it's something we all have to get accustomed to if we are to control the spread of COVID-19 in our population. This, along with the other measures that we have been outlining for a while now: social distancing, washing of hands often, keeping your hands out of your face, and cleaning of frequently touched surfaces. Now, in searching the literature, there are 2 compelling case reports that I came across that suggest that masks can prevent transmission in high-risk scenarios. In one case, there was a gentleman who flew from China to Toronto, and subsequently he tested positive for COVID-19. He had a dry cough, but he wore a mask on the flight. And after contact tracing, because there must be contact tracing for persons who were close by, contact tracing was done for 25 persons closest to him on the flight, and they all tested negative. So that shows the power of wearing a mask. If you have symptoms, you can prevent others from getting infected. And there was another case in late May where 2 hairstylists in the US had close contact with 140 clients while sick with COVID-19. Everyone wore a mask, both the stylists and the customers, and none of the clients tested positive. Yes, I agree that these are just 2 case reports, but they suggest that masks are important in reducing the spread of COVID-19. So masks do help to prevent spread, but I also urge physical distancing, of course, and frequent hand washing. So I encourage persons to always wear your mask in public spaces where you are in contact with other persons, and those around you should also wear their masks. Thank you.
Thank you, Dr. Judy Nisbet. I'd now like to welcome our media houses to ask any questions that they may have. So no questions, I'll just wrap up. Thank you all for viewing, and I want to thank the media houses for joining us today. I also want to take this opportunity to remind persons of ways to protect themselves. As mentioned before, some of the measures: wash your hands frequently with soap and water, cover your cough and sneeze, avoid touching your eyes, nose, and mouth with unclean hands, disinfect frequently touch areas and surfaces, eat lots of fruits and vegetables, and drink plenty of water and have lots of exercise. Practice physical distancing. Use a face mask or face covering when in public, and stay at home when ill. Just want to remind persons of the signs and symptoms suggestive of COVID-19. Some of those are fever, cough, shortness of breath, runny nose, sore throat, loss of taste and smell, among others. Sign up for the Nevis Health app, where you can monitor for these signs and symptoms at kn.unhin.org, or you can use your phone to scan the QR code displayed on the TV screen right behind me. I want to thank you, Disaster Management, Nevis Television, Caribbean Digital Displays Limited, Cornerstone, and members of the COVID-19 Task Force here on Nevis for making these briefings possible. I am Nadine Carty-Keynes. Please join us again on Monday at 8:30 p.m. for another Nevis COVID-19 EOC briefing on Nevis Television. Thank you for viewing, and please do stay safe.